Ventricular septal defect treatment options. As one of the most common congenital or inherited heart conditions, ventricular septal defects, or VSD, is defined as a hole in the heart wall that divides the lower chambers of the heart. This gap allows oxygen-rich blood to mix with oxygen-deprived blood, ultimately preventing the blood and organs from receiving the proper amount of oxygen required for healthy development. Because the heart doesn't fully develop during pregnancy, the child may experience breathing complications, blue-tinged skin, lips, and fingernails known as cyanosis, and a quick, irregular heartbeat known as a heart murmur. Additionally, feeding difficulties may lead to poor weight gain and slow growth. When the previous symptoms are present and VSD is suspected, a chest X-ray allows the doctors to view the heart and measure its size. The doctors are also able to observe the location of the defect and check for any additional complications. An electrocardiogram, or EKG, records the heartbeats and determines the strength and frequency of the impulses. These signals are sensed by sticky patches attached to the body known as electrodes. Using ultrasound technology, an echocardiogram is used to study the anatomy and blood flow of the heart. If not already seen on the X-ray, the location of the defect may be determined and pressure in the ventricles is measured. This test is most important when making a confirmed diagnosis of ventricular septal defect. The chart provided here represents the percentage of patients according to age at the time of diagnosis of ventricular septal defect. As you can see, 43% of the patients diagnosed with this condition are between 1 month and 1 year old. Secondly, 35% of cases are identified between the ages of 1 and 5. Less commonly, 16% of patients are diagnosed between 5 and 10 years of age. With advances in modern medicine, multiple options are available to treat the symptoms of VSD and possibly lead a child to live a normal, healthy life. Routine visits with the cardiologist, prescription medications, and feeding support can aid in managing the condition. Additionally, a heart catheterization or open heart surgery may be required to mend the gap or hole. Because treatments of VSD are based upon the size of the defect and severity of the symptoms, routine visits to the cardiologist can help manage the condition. Tracking the state of the disease, answering questions about new observations, and providing information about lifestyle choices will be included during the visit. Further testing and additional recommendations may also be made at this time. Medications may be prescribed by the specialist to help the body control the side effects of ventricular septal defects. Medications prescribed will not make the hole smaller or cure VSD. Medications may, however, help the heart beat stronger and pump more powerfully, lower the body's blood pressure, and remove excess fluid, allowing the blood to flow more easily throughout the body. Infants may become tired quickly and early into feeding sessions, preventing them from consuming the proper amount of nutrition needed for healthy growth. A nutritionist may prescribe a diet or formula for infants that is calorie rich that will help the body sustain a healthy weight. Some younger infants may require a feeding tube for eating to ensure they are receiving the proper amount of nutrition. Small to medium-sized defects in the heart wall may be closed during a procedure known as a cardiac catheterization. Here, the blood pressure and oxygen levels in the ventricles are recorded. A thin, flexible tube is placed in the femoral artery and thread to the heart. An implantation device is then inserted, creating a permanent seal between the two chambers. The following slide includes a brief video demonstrating the insertion of the device and closure of the hole. Large openings in the septum may require surgical repair. During this procedure, the chest wall is open, exposing the heart for access. A permanent fiber-like material fills the gap, which will eventually be absorbed by the body, creating a lifelong closure. After the procedure, the child will be closely observed by hospital personnel. One surgery is usually sufficient to mend the hole, and the symptoms associated with VSD should eventually subside. If ventricular septal defects go untreated, the child may experience more severe symptoms. The heart may not be able to beat properly, resulting in heart failure. Endocarditis or infections of the heart may develop, or blood clots may form, increasing the risk of stroke. Arrhythmias and heart valve problems may also result.